We're now joined by Chris Paladino, president of New Brunswick Development Corporation, otherwise known as DevCo, and also Dr. Stephen Libutti, senior vice president of oncology services at RWJBarnabas Health and director of the Rutgers Cancer Institute of New Jersey. Gentlemen, good to see you.
Good to be with
you, Steve. Yeah, great to see you, Steve.
By the way, RWJBarnabas Health, a significant underwriter of public broadcasting, as well as the work we do in healthcare. Chris, let me ask you, we're about to show some renderings. I'm going to put this into perspective. There is a very significant cancer center groundbreaking coming up. This will be seen later. What is this building, this cancer center, excuse me, and why is it so significant?
Well, it's a, it's an extension and expansion of the legacy of the Rutgers Cancer Institute in New Jersey, which is the only NCI-designated cancer institute in the state of New Jersey. It's going to provide 530,000 additional square feet for research, clinical care, and for the first time, inpatient care for oncology patients in the state of New Jersey, all in one building. It'll be a standalone cancer hospital. And it's just going to, allow the folks who work with Dr. Libutti, either as researchers, as physicians, as other diagnosticians, to be able to provide state-of-the-art, world-class care close to home in the state of New Jersey.
Jump in, Dr. Libutti.
No, I think Chris said it very well. The exciting part of this project is that the citizens of our state won't have to feel compelled to travel out of state for exceptional care and to participate in cutting-edge clinical trials. A facility like this is really something that's going to set a new standard for the state of New Jersey. As Chris mentioned, both inpatient and outpatient care taking place in the same building that allows us to coordinate that entire cancer journey for patients. If a patient's an outpatient and then needs admission to the hospital for some additional care, the same team will be caring for that patient. And so there's no need for transition of care or complicated communication. It essentially wraps a blanket of support, reassurance, and care for that patient as we navigate them through their cancer treatments.
Hey, Chris, explain to folks why the New Brunswick Development Corporation, DevCo, is even involved in this in the first place.
Well, this is another example of, in New Brunswick and more and more across the state, how we help build public-private partnerships, particularly with our anchor institutions. This project is obviously led by Dr. Libutti and the Rutgers Cancer Institute of New Jersey, but it is a partnership with RWJBarnabas Health, the Middlesex County Improvement Authority. Middlesex County has contributed to this, the city of New Brunswick. It really has, it has so many multiple dimensions. As part of this project, we're building this across from Robert Wood Johnson University Hospital on the site of what had been the old St. Peter's High School, and then had been for a short time, a elementary public school. And as part of this project, we are building a brand new $55 million community school, about 5 blocks, for the community as part of this. And it's just another great example, particularly of how Robert Wood Johnson Barnabas Health System really does act as an anchor institution, affecting so many of the lives of the greater community.
Dr. Libutti, let me ask you a larger question about cancer care as we do this program at the end of June 2021. The impact of COVID on cancer care, describe it.
So COVID has obviously been a major challenge across the board. It's certainly been a challenge for those of us that are focused on cancer care and cancer research. And one area that it's impacted tremendously is cancer screening. So during the periods of lockdown and during the periods before we had a vaccine for patients, people were not doing the typical screening exams that are necessary to detect cancer at an early time. Mammograms, low-dose CT scans for lung cancer, colonoscopy, and data from the National Cancer Institute predicts that we may see increases in cancer mortality and cancer incidence over the next 5 to 10 years as a result of that decreased screening. And so one of the areas that we are particularly focused on is increasing cancer screening and early detection through a partnership we have with the state of New Jersey called Screen NJ, which
But by the way,
focuses on
I want to be
screening.
clear, Doctor. Sorry for interrupting. Part of the concern is that if we miss on the early detection end, there are greater risks of serious illness, if not mortality. Am I
Absolutely correct? Absolutely correct. And so we tend to diagnose cancers at a later stage if we don't detect them during screening, and often at a later stage, they're much more difficult to treat and results in higher risk of mortality.
Chris, let me ask you this. You and I have had so many conversations offline about a whole range of issues, but when it comes to the impact of COVID on development, economic development projects, which again, it depends upon where you are, it depends upon a lot of variables. But what impact has it had from your perspective on economic development initiatives?
Well, ironically, with respect to this project and the New Jersey Technology Innovation Hub, which we're breaking ground on later this summer, we were at a period of time where working from home really didn't hurt us. We were doing a lot of planning, we were doing a lot of meetings, we were able to actually learn how to use Zoom. So we were able to move this project along. It was very different doing, probably for this project alone, 10 public meetings to get the various approvals, and that was a bit of a challenge. So we didn't lose any time. What we're now facing, which is a little bit of the unknown of the cost of material. A lot of people are now getting projects going at one time, so I'm somewhat concerned about the availability of labor, and then certainly the supply chain with respect to getting materials from different parts of the world and different parts of the country. So there's a little bit of an unknown. I think everybody who's involved as a partner in this project really hunkered down, and we kept it on track. But we've got some hurdles yet.
By the way, before I let you go, the name of the new cancer center will be?
Dr. Libutti?
So we're very excited with the generosity and commitment of Jack Morris, who is chairman of the board at RWJ University Hospital and the inaugural chair of the RWJBarnabas Health System. The new pavilion will be called the Jack and Sheryl Morris Cancer Center at RWJBarnabas Health and the Rutgers Cancer Institute in New Jersey. And we're ecstatic to have Jack and his family associated with this project as he's been instrumental in driving this vision forward.
Thank you, Dr. Libutti. Thank you, Chris. We appreciate you being with us, and we'll continue to follow the development of this initiative. Thanks so much, gentlemen.
Thanks, Steve.
Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, Johnson & Johnson, MD Advantage Insurance Company, NJM Insurance Group, the Fidelco Group, the New Jersey Board of Public Utilities Clean Energy Program, Prudential Financial, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber and by bestofnj.com.
New Jersey's Clean Energy Program offers financial incentives for New Jersey residents, business owners, and local governments to help save energy, money, and the environment. Learn more at newjerseycleanenergy.com or call 1-866-NJ-SMART. New Jersey's Clean Energy Program. We're lighting the way to a clean energy future.